Hello, it's Larry again. Now, 6 weeks after radical prostatectomy surgery for the removal of the prostate gland. As I'd said earlier in my videos, I've been trying to keep a running list of things that I've dealt with, so maybe you can have some insight as to what you may have to deal with if you have that surgery coming into your life soon. So, what I have learned in the last 2 or 3 weeks since my last post is that you do in time begin to find ways to deal with incontinence. And you kind of learn as you go. I mean, you can read a lot of stuff and you can get a lot of ideas from people who have been there and done that. But basically, you're going to be different from the other guy, most likely. We're all different as to how bad it is or how we deal with it. Started off using the Depends, as I mentioned in my other videos. But if you go out for more than maybe 3 or 4 hours in the public, which I have to do a couple of times a week because of my business, that is not a good option, for me anyway, at my flow rate, particularly in the summer when it's hot, because the odor can begin to build up, and that's the last thing you want to happen around customers. So I did find a actual catheter. It's called an external catheter. That's what I want to talk to you about today. That is a condom, literally, that goes around your penis. Comes in, I think, 5 different sizes. You'll have to figure out what size you need to have a good tight fit. And that is something that I want you to really think about. Make sure you get a fit that's tight enough so it doesn't slip off, because that can happen, and then all of a sudden you're out there in public, and if it slips off, next thing you know is the front of your pants are wet, and you're embarrassed. But it does work well when it's in place and stays on. The way it works is the condom slides over the end of your penis. Then there's a tube at the end of it. There's kind of like a collection point at the end of the condom that goes into a smaller tube that then plugs into another tube for a tight fit that goes down into a bag that you can strap to your leg. I strapped it just below the knee down to my calf, so it's down low enough, because the tube that comes with mine was pretty long, and I actually considered cutting it off. I thought it was a little too long, but you want it to keep flowing, so what it does, it flows into the bag just like when you have the regular catheter on at the hospital. And the neat part about it is at the bottom of the bag there's a little valve, I'll call it, that's simple to push. You go into the bathroom, I just roll my pants leg up enough to get to that bottom part, which is only a few inches above the ankle, but my pants have covered it. I roll it up, put my foot up over on the toilet, and aim it into the toilet, push the button that opens the valve, and all the urine flows out of the bag into the toilet. You push it back to close it, put your pants leg back down, and out you go. You're dry. There's no odor, and when it's attached, it works well. Now, I say all that to say this. I used it today in one of my outings where I was out in public for 5 hours, and I made the mistake of wearing a pair of pants. I learned later what caused this, that was too tight, and when I would move and twist and turn and up and out of my chair 3 times in 4 hours, it disconnected, and I looked down and saw that my front of my pants was wet. Very embarrassing. Had to run to the men's room, try to reconnect it, and it all happened because the pants were not loose enough to allow that to move around when I moved without getting into a bind and unplugging it, if you will, or having it to slip off. So if you do go that way, which for me works well when it's attached, I highly recommend it. Because, listen, wearing Depends, like I say, particularly in the summertime, gets old, and there are drawbacks to that. I mean, it's great technology for what it does, but then also you might want to consider a Weisner clip. You can Google that. Amazon has them. It's actually a clip that goes over the penis that you can squeeze down to the tightness that, will fit you, and it will actually pinch off the urethra, so it keeps you from flowing. It's kind of like a manual valve, if you will, a shutoff valve, if you want to think of it that way. Now, I've not tried that one yet, and I've read lots of reviews from men who have, that actually give it good marks, but then there again, some guys don't give it good marks. Everything has a downside to the upside. So keep experimenting, keep finding what works for you, and I will tell you this, or at least for me, there will be days that you will get totally discouraged. I have. I'm a very positive person, and I try to be positive with everything that I have to deal with in my life. But there will be days it'll get you down. Like today, when I was out in public, I mean, I was pretty bummed out after 3 disconnects and wet pants 3 times. But you have to deal with it, and I'm at a stage, apparently because of my age, that it's probably going to be a year for me, from what I've read. And I'm only 6 weeks after surgery right now. So I got a long road ahead of me to deal with the incontinence. I hope that yours is not that bad, but I think it'll depend on a lot on from what I've read and learned from people is the older you are, typically the worse that is time-wise. But that's where I am, 6 weeks after my surgery, and I want you to try to have the best mental attitude you can have when you go into this, because it's a process and it takes a while. But I'll keep you up to date on what comes next. This is Larry, and I'll see you next time.